All right. Hello, everyone. My name is Maggie, and welcome to the Night Ministry's fourth Facebook Live event, Taking Healthcare on the Road. Nearly 77,000 individuals struggle with homelessness a year in Chicago. An estimated 1 in 10 Chicagoans lives in extreme poverty. Healthcare is a particular concern as people experiencing homelessness or poverty are at higher risk of acute and chronic disease. Yet they face significant barriers in accessing care. The Night Ministry's Outreach and Health Ministry program addresses the healthcare needs of our community members experiencing homelessness or poverty. The Outreach and Health Ministry program, or OHM as we call it, was launched in 1989 using a converted 27-foot RV to provide medical and HIV services on the streets, at shelters, and through drop-in programs serving homeless young people and adults. The OHM program now includes a 38-foot health outreach bus and street medicine team. Today we are going to focus on the health outreach bus program, which visits underserved neighborhoods across the city. We are very lucky to have Chandra Matteson joining us today for our discussion, a nurse practitioner at the Night Ministry. Chandra is a family nurse practitioner with over 25 years of experience in a variety of healthcare roles and settings. She started the Night Ministry in 2019 after finishing the Master's in Nursing program at the University of Southern California. She has a keen interest in the health and well-being of vulnerable and at-risk populations who lack access to high-quality medical care, and in finding innovative ways to meet patients where they are along the healthcare continuum. She is a current participant in the Rush University Opioid Use Disorder Treatment Fellowship ECHO program, the goal of which is to increase access to treatment for those living with opioid use disorder. In her spare time, Chandra enjoys cooking, cycling, movies with surprise endings, and asking to pet other people's dogs. Welcome, Chandra. Thank you so much for joining us today.
Thank you for having me.
All right, we are going to get started here with our discussion. Please feel free to type any questions you have for Chandra in the comment section, and we'll do our best to answer them as they come or at the end of our conversation. Okay, so right now we have some initial questions to kind of just get the conversation started. Chandra, I'd love if you could just kind of start with how the health outreach bus meets the individuals within our community and their needs.
So the health outreach bus is, like you said, a giant 38-foot RV. We drive around to different neighborhoods within the city of Chicago. Most of them are poorer neighborhoods or neighborhoods with fewer resources. And we provide a meal, we provide some basic health care and support, and we provide some case management also to folks in those areas who really are in need of those services. And all the while, our focus is to kind of treat people as fellow humans who are worthy of that support, because a lot of times people in these communities are marginalized. And so we feel that that's part of our mission, is to make them feel comfortable and to be friendly and to make sure that we can meet some of their social needs as well as their healthcare needs.
Yeah, great. And you kind of just touched on it a little bit, but for those people that may not have experience with this population, what are some of the conditions that your clients experience, and why is it so important to support their healthcare needs?
So a lot of the communities that we are in have a lot of the folks in our communities that we're in have conditions that would ideally be treated by primary care. And as we know, minority communities are often overlooked and often do not have access to the same kind of primary care that many of the rest of us have the privilege of having. So we see a lot of folks for high blood pressure. We see a lot of folks for asthma, for diabetes, skin infections, as well as just bumps and bruises and scrapes and everyday things that they might happen to come across. We do try and address those needs so as to keep them out of the emergency medical system. which saves a lot of money in the long run. We also, a lot of those folks in our communities have relatively low health literacy. So there's a lot of need for education. So we do try and provide a fair amount of education. We touch on a little bit of addiction and mental health. And all of these things can lead to a poorer quality of life and decreased life expectancy. So our goal is to reduce the disparities found in these communities and to kind of address those things and bridge these folks into care so that we can get them better taken care of on the whole.
Wow. Yeah, that's amazing. And as far as we know that, again, the big RV was kind of first brought on board back in 1989. How has the Health Outreach Bus program evolved and continues to evolve? In what ways?
It just seems to be getting bigger and bigger. So if you look at this from the perspective of, this all started with a guy who was doing this out of the trunk of his car. We just have a much, much bigger car and a much, much bigger trunk. I like to think of us as an extension of his outreach. And I feel like because we've got such a good team, we are just always finding ways that we can serve the communities that we're a part of now. And we are definitely a part of these communities where we go in and people, have expectations of us. And it evolves according to the needs of the community, I guess I would say. And our community members are very good at, helping us understand what their needs are.
Yeah, great. I love the way that you kind of describe that learning process. That's really cool. So in terms of the bus schedule, can you just share where the bus goes throughout the city? And also a little bit about how, the night ministry and OHM as a program chooses where the bus provides services.
Sure. So we provide services, I think in 6 different areas. I'll have to count on 2 hands, I think. So we go down to the far south side. We hit South Shore. We are in back of the yards. We go out to Humboldt Park. We are in Pilsen, 10 South Kedzie, and in Douglas Park on the weekends. And our newest site is in Rogers Park. And we kind of let the flow of people that we serve dictate where we go. So if we see that we're seeing a downturn in numbers and folks, like maybe the neighborhood demographic is changing, we don't have as many people coming to us for services, the management and the bus staff, we kind of brainstorm together to figure out where we could go, where our services might be better utilized. So it's a little bit of a group effort trying to figure out, where we can go and where we can be the most help to the largest number of people.
Mm-hmm. Absolutely. And you've spoken a little bit about how, it does sound like kind of we go where, the individuals we serve lead us to go. And I wonder how also the services that we provide shift seasonally to meet kind of the different needs that might come with summer versus winter.
Well, that's an interesting question, given that we're in the middle of a pandemic. Because the needs shift seasonally. We have different focuses in the summer than we do in the winter. In the summertime, we have a lot fewer people having, say, for example, asthma exacerbations. In the summertime, we're more concerned with keeping people hydrated and fed, and in the wintertime, we're concerned with keeping people warm and housed in stable housing, not in unstable housing. It's a lot easier to have unstable housing, I think, in the summertime than it is in the wintertime. But we try to provide the same high quality care regardless. Right now, it's a little difficult just because we are not actually seeing clients in my office. In the bus, I have an office, and where I'm not actually able to see clients on the bus right now, and that'll be an interesting challenge to face come wintertime, when we're seeing everybody off of the bus in the cold. But as far as serving the clients, the need is pretty great all year round, but we just have kind of a different health focus between winter and summer that just is based on, what kind of things we're seeing, what kind of things that, we're seeing as practitioners on the outreach bus.
Sure. And as far as services that are not able to be offered through the health outreach bus, can you, so there's capacity issues and we can't, provide everything, right? So how do staff kind of help to bridge those gaps and really provide wraparound services to those that individuals we serve?
So that's a good question. Even when things are running optimally without a pandemic in place, there are some things that we can't do on the health outreach bus. We don't, for example, at the moment, we don't send out labs for testing for, say, routine blood testing, cholesterol and diabetic labs and things like that. We do STI testing, typically HIV and gonorrhea, chlamydia, syphilis testing. But again, that's sort of been curtailed because of the pandemic. But there are some invasive procedures that we can't do. We can't do X-rays, we can't do ultrasounds. Ultimately, we rely on our network of community health centers and hospitals that we've established relationships with to help us out with that kind of stuff. So there's a fair amount that we can't do on the bus. But it feels like the things that we can't do on the bus are addressed by our connections with other people in the community and places in the community that we have done outreach to say, hey, we have these clients who have these needs, how could you help us out? So while there's a lot that we can't do on the bus necessarily, there's a lot that we have access to because we've built those relationships.
Yeah, great. That's awesome. And then as far as, I know that case managers and outreach professionals are also a big part of the health outreach bus. Can you speak a little bit about their role and kind of interaction of all three of your roles on the bus?
Yeah, so the case managers and outreach workers, they are what make the bus run. I could not do my job without them. They could probably do their job without me. The case manager is responsible for pretty much anything, and I am really fortunate in that we have an excellent case manager on the bus right now who is able to get clients into care and is able to find resources for, say, clothing and furniture and housing and things that I'm just not able to keep up with. The outreach professionals on the bus, whether they're ministers or the drivers or whoever happens to be riding with us, those folks are the backbone, really, because they're the ones who have been at it the longest, and they're often the folks who have the best relationship or the strongest relationship with our clients at the stops. So they're important as far as making sure our clients feel welcomed and sort of addressing their needs ahead of time and sort of triaging, do they need to come to the case manager, do they need to go to the nurse, or do they need something else entirely, do they need the minister to come and sit with them, whatever that is. They're very attuned to what the clients need because they're the face of interaction. They may interact with every single person at a stop. I may only interact with 3 or 4 or 5 people at a time. Mm-hmm. So I depend on them to be my eyes and ears a lot, saying, this person looks like they're having an issue. Could you see them? Or saying to the case manager, this person needs this, that, and the other. Could you please address it with them? And and we all work as a team, and we have a really, really good team. But they are the ones who who do all the heavy lifting. I feel like I just show up and kind of do my thing, but I could not do it without any of them.
I feel like you're being very humble. Maybe a good follow-up question is I know that you do have a very large role as well as other nurse practitioners. Can you speak a little bit about different roles outside of the health outreach bus that the organization and the night ministry really rely on the nurse practitioners to do?
Sure. So in addition to doing the bus, we also have a provider, nurse practitioner who will, all of us have the capability of working on the street medicine van. So we take care of the bus, the street medicine van, And then we have a role in the care of our shelter clients. Mm-hmm. So we are responsible for making sure that their health needs are met as well while they're in our care. In addition to that, we do a lot of engagement within the community. We, keep a pretty good eye on trends and things, particularly right now, just trying to head off problems before they actually occur. So we do have quite a bit of responsibility. It's not all just the mobile part of it. There's a lot of in the background that goes on that we do, particularly with the shelter clients, to make sure that everybody's healthy and safe.
Absolutely. I just want to pause really quickly to remind our viewers that if you have questions, please go ahead and put those in the comments so that we can get to them. Okay, I know that everyone is definitely anticipating the coronavirus of this interview. So let's jump right in and, how has the health outreach bus adapted due to COVID, and what services have had to change or shift and adapt with that?
Wow, that's a big question. We have done a really, really excellent job, in my opinion, of making sure that we keep ourselves and our clients safe first and foremost. Like I mentioned before, one of the main things that we did was we took services off the bus, which makes things difficult, and our clients have been very patient with that process. We no longer are able to have folks in an enclosed space and on the bus in the case manager's office or in my office. So it's very difficult to do exams. So we also had to work at the beginning of the virus, although this is sort of getting a little bit better now, with just 3 of us working the health outreach bus in an effort to keep the number of people in the bus to a minimum, so that we were limiting our contact with other people as well. We are trying to do some testing that we wouldn't normally be doing. We're trying to do some COVID testing that we wouldn't normally be doing. I am having to refer a lot more people out to care, and I feel like the case manager probably has a similar situation. So we've adapted really well. We've adapted the best that I feel like we could have adapted, given the circumstances and given the nature of what we do. It is very difficult to have care given on the street, whether it's case management or healthcare. But we have done so with an attitude of these are our clients that we're serving, and this is the way that we need to do things in order to keep them safe and to keep them well, and to keep ourselves well also. So little things like that. So decrease number of staff, increase number of referrals out for care, and in general, just being a lot more cognizant of our cleaning procedures and our hand washing and all the hygiene things that go along with that.
Yeah, for sure. And I mean, you all are just so inspirational, I think, to a lot of people, just because of the continuing of all the services. Nothing stopped.
Right.
Yeah.
Yeah. Exactly. We continue to provide meals. One of the things that did actually happen as a result of this also that I forgot to mention is that we used to go from having, so our stops they feel very family oriented, like as in our clients are our family. So one of the things that had to stop when the restrictions went into place for COVID was we went from having these almost like little community get-togethers, community gatherings. People are no longer encouraged to hang out at the bus, which was sort of our thing. People hang out at the bus and people can come and have a conversation. They can stand and have a cup of coffee. Some people would stay for the entire length of our visit, the entire 2 hours that we were to stop. So that changed, and then we went to kind of having to serve only sandwiches and things that were easy and things that we could package so that we weren't, having people serve, food that could possibly become contaminated by having a large crowd of people around it. So keeping the crowds down has kind of put a damper on that. We're not as able to do that, and that's been one of the real drawbacks of having things. We've been able to keep the services going but there's been a little bit of a sacrifice in that our face-to-face contact with our clients has not been quite as extensive as it was prior to the pandemic hitting.
Sure, absolutely. We did just receive a question, and it's, what do you do if you found or did find a client that had coronavirus? What were the steps that you all had to take in that case?
So I've been really fortunate. So none of my clients have tested positive yet. So I've not faced this situation personally yet. I'm sure it's coming. We have a plan in place that if we do have somebody who we think is positive for coronavirus, at the moment now we are able to test through our partnership with Howard Brown. So we can now test them. We then will give them instructions to go home and quarantine themselves. We give them instructions for what to look for in order to head to the emergency room. If we were to find out that somebody was actively positive, I mean, obviously we can't force people to go and get care, but that is our goal, is to get people into care. So we would find, the nearest place that we could get them to and find a way to get them there, whether it be by, having a mask on them and having them go in an Uber, or, making sure they get there in some way so that they can get the care that they need. More so for most people who end up with COVID, I would hope that, as we keep being told, if you're infected and you're not terrible, you just need to have the education. You and your family need to have the education to make sure that you can quarantine yourselves. And obviously that's very difficult with some of our populations who live in apartments with a lot of people in them. That's going to be really difficult for them to do, but kind of teaching them, these are the best ways that you can handle yourself as an infected person. This is how you keep your family from getting infected, washing your hands and keeping your mouth covered and keeping yourself in a separate room from everybody. So it's a lot more education, and then just being very, very aware of what their actual situation is and whether or not they are in need of having to go and seek a higher level of care than we're able to provide out on the streets.
Sure. And then we also had a question from Anna that fits into this conversation. And she asked, did you guys ever consider stopping all care when things got scary?
I never heard that mentioned once. So to our credit, I definitely wondered about my wisdom of my career choice for a couple of weeks. And I think that anybody who's in healthcare right now and tells you otherwise is probably not telling you the truth. Mm-hmm. But there was always the discussion here in our group of people with the bus and the outreach van. It has always been around, okay, well, our clients continue to need us whether there's a pandemic or not. Like, our clients need us. We provide a valuable service to them. So I don't think that stopping care entirely was ever something that any of us was going to kind of allow to happen, if that makes sense. So I think there would have been a mutiny of all of us saying, there's just no way we can stop all care. Let's figure out a way to do it so that we're safe. And whatever we have to do to that end, that's what we'll do in order to make sure that we continue our services the way that we've been, in as much in the way that we have been providing them as we can, while keeping all of that in consideration. Sure.
Again, you guys are just so amazing for the work that you continue to do for the individuals that need you. It's really inspiring. I was hoping that you could touch a little bit about how has the pandemic impacted the people that are served by the bus and the homeless population and community? In what ways has COVID-19 really impacted their lives?
So that's a great question. The main thing that we noticed when this all first started was that a lot of our homeless and unstably housed clients were no longer able to hustle their living because of the number of people that stopped coming in and out of downtown. That made it very difficult for our folks who live downtown or who stay downtown to do. There is a lot more food insecurity now. So, I mean, we also see a fair number of people now who are wanting to get into treatment for opioid use disorder. They're not able to either afford or find the drugs that they use. So we've seen a lot of people. That's actually been a really nice silver lining, I guess, is that a lot of folks have come to us saying, "Hey, you know what? This is a good time for me to, to stop. And what can you do to help me?" And it's led us to a partnership where we are now able to provide Suboxone services off of our bus and off of our street medicine van. Mm-hmm. So, I mean, I think that our clients don't have a whole lot, right? So when this all happened, they had less than the nothing they already had, which, seems pretty dire. But I think it speaks a lot to the constitution of our clients that, they've all managed to kind of plow through this and get to where they are and sort of find a stable place to be until this situation is over. But there's definitely been less out there than there was before the pandemic started.
Mm-hmm. Mm-hmm. And you kind of touched on this, I think, a little bit earlier, but are there any takeaways or recent lessons that you've experienced or kind of seen happen in the past year or, even the past 2 months that you're hoping the health outreach bus will continue to implement into the future?
Yeah, I mean, I'm hoping that this Suboxone thing continues. Actually, I'm hoping that that's the one thing that we get to continue out of all this. That they don't start putting all these roadblocks into our being able to provide care to our clients. I feel like the virus took down a lot of roadblocks for a lot of things, for a lot of social services, because we are in a moment right now where we're really trying to make sure that everybody has the best care that they can get, whether that's, regardless of what that care looks like. So I guess my biggest takeaway is that, if we're able to do this stuff in a pandemic, then why can't we make it work in a not pandemic, if that makes sense? So my biggest takeaway basically is that I feel like we have the ability to do these things. Why can't we make them happen when we're not experiencing a crisis like this? So, and also just, again, the resiliency of our clients and of our staff, actually, of the people who continue to show up at work every day and continue, even when working from home, to show up for the clients that we have. Like, we've all sort of teamed together as the team that we present ourselves as. That's a real thing, as an organization. I feel like what we've been able to do and offer during a crisis situation has been really remarkable. So that's the other takeaway, is that, when we all get together, we have quite a lot of power to affect change for the people that we serve.
Yeah, absolutely. I just got goosebumps. That was very well put. And then the Outreach and Health Ministry program recently transitioned, along with a couple other programs, to our new location at 1735 North Ashland. I was hoping that to kind of wrap things up, I know we have a few questions that we will get to after this. But how has that transition gone? And it is a big move in the middle of another, big event of the pandemic. So how has the transition affected the health outreach? Just how the program is doing in general with it?
It's great, actually. This is a much better space for us to be in, and I am forever grateful that we managed to make two moves, actually, in a short period of time with the pandemic in the middle of it. It makes all of our jobs on the health outreach bus and on the street medicine van a lot easier, because we're not, at least for the bus, everything's in the same place now. So. Whereas before we had the buses parked somewhere else and we had the office somewhere else, and then, we have some of our storage offsite. So now everything's in one place. It's all centrally located. Everybody's located in the same place. So it's much easier to, say, get a hold of somebody from our donations department to say, hey, do we have this, that, or the other? It's lovely to come back to the office and be back at the office and not be kind of in another, transition. So, and again, that fact that we were able to move, I think, just speaks to the awesomeness of everybody who works here, that we were able to do that and relatively smoothly. And now it's just a matter of, getting settled in, and we love the fact that we can, park our buses here, and our storage is all here, and the people that we need are mostly all here when they're not working from home. But so it's a little hard actually to say how great it's going to be once it's actually done, because we are still limited by the fact that we don't have a whole lot of people coming to the office all the time. So, but I think that aside, it's been great.
Yeah, great. That's good to hear. Okay, we do have a couple of questions. Again, if you would like to ask Chandra any questions, please comment, and we will get to it in a few minutes. So we have one question for Armand. Is there anything common passerbyers can do to make your job easier?
No, I mean, being friendly, kind of recognizing the job that we're doing with the clients that we're doing it with. And yeah, there's not really anything in particular. Mostly we like it when people come and ask us what we're about, because we like to be able to talk about ourselves, as I'm sure all organizations do. But to make our job easier, there's not really anything in particular. We like people to be friendly, obviously. And we love to, answer questions about the services that we provide. So just coming by and being like a friendly face, and realizing that, we're not a threat, and our clients aren't a threat. And I feel like sometimes people, sort of, give us the side eye once in a while. It doesn't happen very often. So it's hard to say. So we don't really have people, hassling us or making our jobs harder. So it's hard to say what would make our jobs easier, but I think just general friendliness and recognizing that we're there to fill a need in the community, and seeing what a lot of people come by and will ask how they can volunteer. So things like that are things that we really appreciate.
Yeah, for sure. And then we did have a question about if you could just speak to what kinds of relationships that you've developed with patients. Maybe a success story that sticks out in your mind.
Oh, sure. I can tell you my favorite success story. My favorite success story is I have a client down in Pilsen who I met back when I started last year. And he was in a really bad situation last year as far as his employment, and he had some major health issues. We have, over the past year, been able to resolve some of his health issues. I see him twice a week. He comes to see me whether he needs to or not. And we have him in primary care now. We have him seeing some specialists for some of his health issues. And that, to me, was a huge success story, because here we took somebody who didn't have a whole lot of options left and had to live on the street, as a lot of people come to living on the street. He lost his job. He lost his insurance. He had some health issues. He was not able to work anymore. And, now we're watching him sort of go from that situation to we're almost to the point where we can get him healthy enough to start working again, which is what he really, really wants to do. And that every time I see him, I am so grateful that he came to us, and that we were able to help him with the things, and that he follows up. He's good about following up. He's good about coming back and letting us know how he's doing every week. And he's my favorite success story, because he's the whole picture, right? He's exactly what our services are meant to do, is to get people hooked into care, whether it's case management, which he's also utilized quite a bit. He's utilized the healthcare piece of it. He comes back to me for just check-ins, just to check on his general health. And he is things are looking up for him, which is the goal, right? Like, we want to help, we want to lift people up. We want people to get to a place where they're able to, access healthcare and be healthy and have a stable place to live and have a hot meal every day. So he's sort of the embodiment of what we do. Even though he's a work in progress, we're not quite to that point yet with him, but we will be. And I don't doubt that if he continues to interact with our organization the way he does, that he will be working soon. I hope. That's my hope for him.
Yeah, that's amazing.
But then I'll lose him as a patient, which would be kind of sad for me. So
that's great. Well, hopefully you can keep in touch.
I hope so.
We have another question from Anna. Have you had all of the donation supplies that you've needed for your clients, I'm assuming in the past few months? And then has there been anything that's really hard to find, like masks or toilet paper?
For the bus clients, I can only speak to the bus clients really, because that's where I am most of the time. For the most part, we've had most of the supplies that we've needed. We did not have trouble finding toilet paper, but yes, that was an issue for a lot of people. The things that we had trouble finding would have been more along the lines of, enough clothing for people, or enough places that folks could access a reliable food source in between our stops in whatever neighborhood we happen to be at. So masks were difficult at the beginning. We now have masks, and from the beginning, we have been trying to make sure that we are prioritizing the clients on the van and the bus, getting masks just to keep us safe as well as to keep them safe while they're coming to get services. So yes, there were some shortages early on. I feel like those have sort of resolved for the minute, and we'll see what happens in the coming months with the way that the virus numbers are going up. Whether that stays true or not, my hope is that we can get a little bit ahead of ourselves in expectation of that happening, and then hopefully we won't be as short on things as we were at the beginning. But we've been very fortunate that we've got great donors who we put out the call and they've responded, so that we right now have things that we need that we didn't have at the very beginning.
Yeah, absolutely. That's good to hear. And then we have a question about if you could speak a little bit about the CTA outreach that kind of started a little bit during the pandemic, and I think has plans to continue.
Yes. So at the beginning of the pandemic, my colleague Stefan, I'm not sure exactly how we identified there. I believe the CTA reached out to us, or the Department of Health. I'm not sure which. I apologize. Reached out to us to see if we could check in on the homeless people who were living on the trains. And anybody who's not familiar, the trains overnight are where a lot of folks sleep during the wintertime because it's warm and it's relatively speaking, safe. So we started going out. First, it was every other week, and then we ended up being stationed at 2 of the terminus locations, where we went out with a little bit of food, and we assessed people for whether or not they'd had symptoms for COVID, whether or not they had been tested in the last couple weeks, and kind of what their general health was, while trying to build a rapport with them, because there's a definite group of people. When we first started out at the beginning of the virus, we were seeing about 150 to 200 people on the trains every night. Towards the end of our first stint on the CTA, we were seeing a lot lower numbers, but the CTA staff were also having people off so that they could clean the trains. Mm-hmm. So it went really well. We eventually, our youth outreach team came to help us. The bus staff, more of the outreach staff on the bus came to help us. The street medicine van staff came to help us as well. So it turned into a big team effort. We did not find a whole lot of people who were ill, which was great. And it also allowed us to get to know people a little bit better who are in that situation, so that, hopefully if they are still in that situation where they're staying on the trains, when we do start going back after the summer is over, because a lot fewer people stay on the trains during the summer because the weather is so much better. When we go back, hopefully there will be they will recognize us as people who are there to help them and not people who are there to, sort of judge them or kick them off the train or whatever they see us. We give them a little bit of food. We can get them, have a little bit of conversation. We can refer them out to either the bus or the van. So that was kind of the nice thing about that, was being able to get people hooked into services, even though we were doing it off-site and off of either of our, the regular routes of getting people into care.
Sure. And is the CPA outreach, is that something that you're hoping kind of is implemented to continue?
Yeah, for sure. Yeah, I think it's really, even if I didn't like doing it, which I did, I would still think it's important because it could pose a real challenge to public health, first of all, to individual health also. I'm hoping that we can either expand on it or at least keep it status quo, so that we're still going out there and making sure folks are okay. And we do a similar, I did forget to mention that we also do a similar thing out at O'Hare, where we do outreach with the folks who stay out at the terminals, where Stefan and I and some of the volunteer medical providers will go out on an overnight, from about 11 to 3 in the morning, and we'll go and check on people, make sure, right now we're making sure they don't have any symptoms or temperature or anything like that. But also we address their basic health needs, as we do on the street medicine van and on the outreach bus. Wow.
A large outreach you guys have.
It is a large outreach. It's unfortunate. I mean, there are enough people to keep us going. So
yeah,
if we could get rid of that, then that would be great. But we're working on it, getting everybody housed.
Yeah, vigorously working on it. Okay, I do not see any other questions. So I think that concludes our conversation for today. Thank you for tuning in, and thank you so much to Chandra for joining us. We really appreciate it. All right, everyone. Thank you again, and everyone stay safe and be well.